Hi, and welcome to Life Addictions, the recovery show. My name is John Lausch. I'm a certified recovery specialist, and today we have a very special show. On our show, we talk about life addictions, whether it's drugs, alcohol, food, or nicotine, even criminal and procrastination addiction. Today's guest is Paul Sloan, president of the Florida Society of Pain Management Providers. Paul, please introduce yourself and tell us a little bit about what it is you do.
Well, I am the president of the Florida Society of Pain Management Providers, and we represent clinics, owners, and doctors involved in pain management in the state of Florida. And as well, I am the owner of 2 pain management clinics in the state.
Excellent. And our other guest is Dr. Stephen Grinstead. Dr. Grinstead is the Addiction-Free Pain Management CEO, and he deals with assistance in the treatment of chronic pain and coexisting disorders. Stephen, please introduce yourself and tell us a little bit more about what it is you do.
Good morning. Yes, I've been working with people with chronic pain and coexisting disorders, including addiction, for over 28 years. Also the clinical director for the Gorski Synapse Corporation, and we train healthcare providers in addiction, mental health, and myself in addiction-free pain management.
Excellent. Now, Stephen is in California, and we are here in Florida. Paul Sloan, you're in Florida as well, is that right?
Right, I'm on the west coast of Florida.
And the reason we have both of you on the show today is recently we had some new legislation passed as far as the quote-unquote pill mills, the chronic pain clinics in South Florida go. Paul, tell us a little bit about what that entails.
Well, over the past couple of years, there's been several pieces of legislation passed to deal with, quote-unquote, the pill mill issue in the state of Florida. And going back to 2009, when they approved the prescription drug monitoring program, which was the program, like many other states have, that monitor the dispensing of controlled substances to help doctors stop the process of doctor shopping, which is a patient going from one doctor to another and getting the same meds within the same 30-day period. That system is now supposed to be up and running by September 1st. Additionally, there was pain clinic legislation that required all pain management clinics to register with the state and the Board of Medicine to set up rules and regulations for the operation of such clinics. And then the most recent legislation, which sort of a hodgepodge of stuff. Unfortunately, it removed the restriction, granted great exemptions to many doctors in the state from the rules and regulations that were developed by the Board of Medicine, and basically set some mandatory penalties for people that violate the legislation. And that went into effect on July 1st.
Paul Sloan, you are the president of the Florida Society of Pain Management Providers, and you have 2 pain clinics. How does this affect your business?
Well, it really doesn't affect my practices in the sense that we, first of all, have abided by the rules and regulations that the Board of Med approved, and we've done so voluntarily since the Board of Medicine came up with these rules and regulations. We're also an ACA licensed clinic, which is the Florida Agency for Healthcare Administration, which sets even far tougher regulations for a healthcare clinic, including the fact that everybody in the clinic has to go through criminal background checks and be fingerprinted, the whole 9 yards. The way I look at it is we've gone from being the most unregulated medical field in the country to the most regulated medical field. And again, I find everything to be doable. It definitely makes it tougher on the patient and the doctors. But, if someone's able to, understand all the rules and regulations, they are doable.
Stephen Grinstead, you're with Addiction-Free Pain Management, and you see these patients, I'm guessing, on the other side of their chronic pain, more or less with addictions. How is it that you keep a person, keep taking these prescription drugs and not being addicted to them?
Well, not everyone needs to be on the addictive type medications for pain management. As a matter of fact, a lot of the latest research both from the American Academy of Pain Medicine and Management and the International Association for the Study of Pain, do show that opiates are counterindicated for a lot of chronic pain management, specifically not because of addiction, because of a phenomenon called opiate-induced hyperalgesia, which means that people get very hypersensitive to pain signals. And the opiates just keep this changing. It actually makes biological changes, not just in the brain, but in the spinal column. And the other thing is that medication is only 1/3 of the treatment protocols for pain management. You know, the latest best practice principles in chronic pain management show a multidisciplinary effect leads to best treatment outcomes.
Tell us a little bit about that, because along with medication, you have other modalities, such as environmental, spiritual.
Yes, I believe that people need to be working biological, psychological, social, and spiritual in order for a good quality of life. With pain management, my system incorporates 3 core components. Medication management, finding the most effective and most appropriate medication for the patient, is 1/3. The other third is to help the patient deal with the psychological and emotional components of the chronic pain, and to help them differentiate how much of their pain is physical sensation, how much is the brain's interpretation of those signals into psychological and emotional symptoms. And finally, the third component is finding non-medication based interventions such as meditation, acupuncture, hydrotherapy, physical therapy, some of the standards, biofeedback. There's literally thousands of different non-medication based pain management, and one size does not fit all. You need to find the most appropriate. Now, if someone also is in recovery from addiction or has become addicted to their pain medications, then we need to deal with the addiction phenomenon also at the same time, concurrently.
Paul Sloan, president of the Florida Society of Pain Management Providers. You represent the providers here in South Florida. Now, I'm guessing, and I've seen some of your articles and some of your interviews, you're totally against these pill mills.
Oh, absolutely. I mean, but I don't think this problem is solely based in a pill mill. I think pill mills have become the talking point, the hot subject, the word that sells newspapers. I think the focus is completely on the wrong issue, and I think it's a disaster because the problem's not going to go away. You could close every pain clinic in Florida, and this problem's still going to exist. First of all, I agree with the doctor about opioid-induced hyperalgesia, and I make clear I am not a doctor, but I do well understand opioid-induced hyperalgesia, and quite simply, it's the issue of basically people actually, the medication makes you become more sensitive to pain rather than numbing that pain or masking that pain. And it's definitely an issue. I mean, patients that ask for an increase in their medications should first be titrated down to see if it is actually opioid-induced hyperalgesia that's increasing their sensitivity to pain. One of the problems with these conversations where we talk about all these different disciplinary or disciplines in terms of pain management and all the items that the doctor listed is, most of the pain management clinics that are dealing with medication exclusively are dealing with people that are suffering from intractable chronic pain, which is far different than normal chronic pain. In fact, there's a separate Florida statute that addresses intractable pain. These are the patients that have been through every type of treatment in most cases. They've had the surgeries. Remember, there's 250,000 patients in this country that go through failed back surgery syndromes. They've gone for surgery, it's failed, and they've basically become what they call spinal cripples. This is a huge problem. We have 25% of the state population that has no insurance. And many of these people are the people that are suffering from chronic pain. They've actually moved to the state for the weather. They need these medications. And there are all these other options either have been tried or they can't afford them. I mean, the bottom line is you've got a huge amount, 3.5 million people to 4.5 when you deal with Medicaid that doesn't really reimburse for chronic pain management. In the state of Florida, 25% of our population that can't afford all these other modalities. And so you have to deal with these patients. And for these patients, the least expensive way to deal with their pain is through medication. So, this is a double-edged sword. You can't take away these things. You can't force them to other modalities if they can't afford it, and you still have to treat them. And we have a state that is basically throwing these people out with the bathwater, and that's a horrible thing.
Now, Dr. Stephen Grinstead, is there medications that aren't, for chronic pain that people do not get addicted to? Is that even possible?
Yes, absolutely. Again, a lot of the pain patients I work with, I consult for several pain clinics in the greater Sacramento area, and some of these people are on, quote, narcotics. Now, narcotics is a legal term, not a medical term. They're on opiates, benzodiazepines, and if they're closely monitored, and if they have family members or close friends who are holding and dispensing, even people in recovery can be on appropriate medication management. But again, the medication is one piece of the puzzle. I believe education is the most important for people. John, I get emails from some people every day through our website that are just in the state that Paul Sloan just mentioned. They don't have a lot of finances. They don't have a lot of hope. They've been discharged from a pain practice because they're inappropriate or because they're afraid the DEA is going to target them if they have many high-risk patients. And one thing I work with these people on is, what can you do? Let's focus on what you can do rather than what you can't do. And I refer them to a lot of the information on our website, which is free, because I believe knowledge is power. The more they educate themselves about what's going on with their body and their mind and their spirit, the more likely they're going to go from having suffering with chronic pain to living effectively with chronic pain. That's my hope for people. And I try to help them as often as I can. And the reality is, the latest research just came out late in June that shows we probably have about 116 million Americans living with chronic pain. And if you look at the statistics with addiction, a lot of those people, probably 90%, according to a lot of the research I've looked at, 90% of people undergoing pain management are on opiates. And probably about 10% of those people have abuse or addiction issues.
Paul Sloan. I'm away from my desk.
I'm sorry, keep going.
So the 10% are getting all the press. The other 90% aren't. And I agree that this pill mill thing is just a big smokescreen. And a few years ago, I wrote a great article. It's War on Drugs, War on Pain Management. And the old, supply side war on drugs is now being applied to pain management providers instead of looking at the demand side or the problem side. How do we help people get their pain management needs met in a humane and yet effective way without the risk of this addiction? And there's over-the-counter medications that cause more problems than all the opiates combined. Acetaminophen, Tylenol. And yet you don't hear a lot about that very often. Every once in a while it hits the radar. Right.
We lost Paul Sloan. Let me try to call him back now and see if he answers. But you're absolutely right. 12 years ago, let's see if he picks up here.
Yes, sir.
Paul, are you there?
Yeah, sorry, I got cut off somehow.
Oh, that's right. We got you back on now. Stephen Grinstead was just giving us some information about some of the interesting run-ins he's had over the years and the different medications that cause addiction, and some that are out there that can be used without a person getting addicted to. Paul, pain management providers in Florida, is there any requirement for them to have pamphlets, give out information about recovery, and if you're, possibly going to be addicted to a substance, do you have any services or products that pain clinics are required to provide clients?
Well, this is actually part of the new legislation is really one of the most horrific things about it is that if a patient shows signs, there's two issues. If a patient shows signs of abuse, or the patient shows signs of diversion, and the law specifically addresses these issues. If the patient shows signs of diversion, i.e. they take a urine test and the medication that you're prescribing is not in their urine, then that's a sign of diversion, and they are to be discharged.
Okay, is that good or bad?
Well, there's no gray area. There's no ability for the doctor to do what the doctor knows best. You basically have to throw a patient out the door because the medication you were prescribing was not in their urine. Now, maybe they were taking medication PRN, and so when you did the urine test, and that's as needed, they weren't currently taking it in that 48-hour period, which would be unusual, but it could be. The issue here is that if a patient that has an issue where the meds aren't in their system, the doctor should have the ability to talk with that patient, understand the issue, and deal with that issue appropriately. The law takes that away from the doctor. The patient is now basically tossed on the street. The way we look at it is it's called patient abandonment, but the law is requiring you to do it. Now, abuse is another issue. Now, they consider abuse to be a sign where if the patient tests positive for a med that you aren't prescribing, i.e. the patient's on oxycodone and comes back with morphine in their system. That requires the doctor to send the patient out to an addiction specialist that's defined in the law. The problem with that is a lot of these patients, again, you're dealing with patients that are not insured, and there's a huge amount of them. I mean, again, we go back to the 25% number in the state of Florida.
Right.
Sending them to an addiction specialist is price prohibitive. They're disallowing the doctor from trying to deal with the situation, deal with a second chance policy, deal with more closely being monitored. The legislature has decided that they are better doctors at this and they know better, and the patient is the one that's going to pay. And to answer your question specifically, there is no requirement to hand out information to them on addiction, on types of treatment programs. I mean, it's the rules and regulations are on how to treat them, how to deal with them, but nobody in this state is dealing with the problem of addiction. And as anybody knows, these medications, if you're predisposed to addiction, and you are put on these medications from a dentist for having a tooth pulled, and by the way, the great majority of patients under the age of 21, their first and most experience with these kind of medications is from a dentist. And a person that is predisposed to addiction, it can happen very, very quickly with opiates or opioids, and it's a spiral out of control, and we don't deal with addiction in the state. We don't fund it to the level it needs to be funded. We don't deal with it. We are going to arrest our way out of this problem, and that's the way the state looks at it.
You're right. Our young kids growing up today with ADD and taking medications at a very young age, I've read several articles to where they're really predisposed to being addicts in the future, and especially with prescription drugs and pills. Stephen, in California, I mean, obviously you've heard of Florida and the big problems we're having here with the pain clinics. What's it like out there, and do you see it spreading in California like it has in Florida?
California had its problems last decade, really, with this, and a lot of legislation came up, a lot of education, and there are really, good protocols in place in a lot of the pain clinics now. And as a matter of fact, last month, one of the clinics I consult with had a spot check by the DEA, and one of the comments they made was, if everyone would be as proactive about educating people about medication and the risks of addiction and have a firm policy in place as you do, we'd be out of work. So I think it is possible, and one of the things, for example, they do, anyone that's going to be prescribed the Schedule 2s or 3s have to have an hour of education, either by a nurse, or sometimes I'm there doing the educational session. It's a one-time, 1-hour educational session that they need to sign off on, that they received all this information and education. And there's very strict medication management contracts that are signed. And if someone does deviate or hit red flags, they automatically are not discharged from the practice. We intervene and assess and see if we can handle it in-house or whether they need to be referred out. And I think that's the piece that Paul was talking about. Many of these problem people can be managed in-house because it might not be addiction at all. It might be a phenomenon that's called pseudo-addiction, which, real simply put, is mismanaged or undertreated chronic pain. And that does not mean you up the dose of the medication, because it may be they're on the wrong type of medications. They may need to be doing other things. There may be a co-occurring medical or psychological disorder that is sabotaging the pain management and needs to be uncovered. And again, we still hit back to that problem that Paul's mentioned several times, is there's not a lot of these people that have the resources to do, quote, state-of-the-art treatment, unquote.
Mm-hmm.
And I don't want to get into learned helplessness about this. I meet people where they're at, and if I can give them just a little bit of hope and a little bit of improved level of functioning and quality of hope, I think I've done well in many cases.
Well, I have to give a plug to one of our featured sponsors. We here at Life Addictions have a recovery program, and it's an audio recovery program. We download the audio right onto an MP3 player, and we call it the Recovery Pod. It's very portable, very easy to use. We have one specifically for drugs. We have one specifically for alcohol, sex and love, procrastination, even criminal addiction. It's a real great tool, and as you know, a person that's addicted needs as many tools as they can use, whether it's a 12-step program, a sponsor, or the Recovery Pod. It's a great product. Many rehabs use it, outpatient centers use it, individuals use it. I don't know if you guys are familiar with the product, the Recovery Pod. What do you think about something like that in a pain clinic to have for the clients to maybe, if they have a problem, they use?
Absolutely. Mr. Gorski was telling me about your product earlier. You had him on your show 5 or 6 months ago, and he was telling me about this. And I absolutely agree. I use a multimedia approach when possible. I use audios and CDs and different approaches with my patients. I also give them resources. One of the resources I give them is chronicpainanonymous.org on the web, which is free for them. So, John, I agree with you. This recovery pod sounds like an intriguing idea, and that I think it can be readily adapted to people with pain and coexisting addiction.
Paul, what's your thoughts on that?
Well, I got to tell you, to be honest, it's sort of getting out of what I know about. I mean, all this, and I read the doctor's website last night, and all this is very interesting. But it gets a little bit beyond it. First of all, I'm not a professional in the sense of being a doctor or a medical specialist in any way, and I believe that anything is a good thing that would assist the patient in dealing with anything from pseudo-addiction to addiction, dependence, and all the issues that come along with being in intractable chronic pain, which is a huge problem with depression. I mean, when your life is turned upside down, you can't function like you used to. You're taking medications which definitely increase not only your depression, but your anxiety. You've got law enforcement, you've got the government officials. Everybody is coming down on you because you're on these medications. To be on pain medications in the state of Florida is got to be the worst thing in the world. And I'm talking about for legitimate pain patients. They are getting taken shots at by everybody from the pharmacies to the doctors to the law enforcement to the government officials. The issue is these medications are hugely needed. They are not illegal. They never will be illegal. We're never going to close all the pain clinics. And we have to look at this from all sides. And again, addiction is a problem, and there needs to be a way to deal with it. And I'm not saying your product's the best, but they're all good. They're all trying to deal with this. But how do you get this stuff to the patient, and how do you get it to them that they can afford it and that it will work? These are always been my problems.
Paul, Stephen, we're coming to the end of our show. This show is going to air on WRPBI TV tomorrow at 9 p.m. And I want to thank both of you. Stephen, give us some contact information where we can reach you, or some of our viewers can reach you maybe an email or a phone number.
Okay, the best way to reach me is probably through my website on the contact page. My website is www.addiction-free.com, and that's addiction-free.com. And on the contact page, my email address, and I'll give that too, it's S, like my first name Steve, my last name Grinstead, at cenaps.com.
Dr. Stephen Grinstead, thank you for being a guest on our show. Paul Sloan with the Florida Society of Pain Management Providers. If there's any contact information where some of our viewers might want to reach you, what would that be?
Well, the best way to get a hold of us is, first of all, our website for the general public is www.floridapainnews.com, and that's either Florida spelled out or FL, but floridapainnews.com, and the Society's website is at www.flspmp.org, but it also can be accessed through the Florida Pain News. And we're more than willing to talk to anybody about this, but we believe that this is an issue that needs to be addressed from far more angles than just a law enforcement angle.
Well, hopefully we can get this information out there and maybe have you guys back on another show. There's a lot to talk about. I want to thank you both, and my name is John Lausch with Life Addictions, The Recovery Show. Thank you.